You come out after my birthday. Okay.
Oh, okay. Yes. Okay. While I'm doing this, let Timmy
It's gonna be real brief.
come up and do her presentation of best dress, what it looks like.
No, that's better for me.
Right. Oh, yeah.
Yeah. So you can come out. You feel no.
Okay. All right. So let's give Timmy a hand. She's going to give us a video about Dress for Success. Come on inside.
My name is Timmy.
You can go all the way to the board.
All the back, right?
Uh-huh.
Oh,
Yeah,
really? Is that YouTube?
Uh-huh.
Wait, let me adjust myself.
Tammy, you're a mess, girl. You're a mess. She is a natural mess. Oh, my goodness. Really, Tammy? You're such a... Smile, Tammy. Stand by your post and smile. Look at me this way, pumpkin.
Another smile, right?
Mm-hmm. You go, girl. You go, girl. Okay, okay. I don't know what I'm gonna do with you.
Okay, morning class. My name is Tammy, as you all know, Tammy P. In a workplace, there are different ways we can dress. It depends on where you work. If you're working in the hospital, some allow you to put on scrubs. If you're working in the back office, you could actually like dress down, not dress down as in like exposing your body, dress down like wearing what suits the environment of where you work in. Okay, the business casual, I'm using an hospital environment, a medical environment as my case study, right? Okay. If you want to dress like business casual, like okay, you go to work Monday through Thursday, Monday through Friday, you don't want to put on like jean, no, it's not ideal. You don't want to put on like what I'm wearing, you can wear it on a Monday to Thursday job thing. So this is more like it, like okay, you're not exposing anything. You're still like cute this way, like you're not like looking mama-ish, looking oldish, but you're still looking funky.
Right.
Or, like you can still put on your slip on, look nice, dress nice, no anklet, like what I'm wearing now. Right. No waist beats, like what I have here. Then for a denim blue jean, this can like suit for a Friday. It's a Friday thing, Friday kind of dressing, like just want to dress down. Not dressing down like your bra strap showing, no. Dress down like, okay, just want to look funky for a Friday thing because after work can set to go for a drink with your boyfriend. So this dressing really suits for a Friday thing. This is for professional attire, probably going for a conference. You have people coming into the hospital. You guys are going to have a lecture, or like, you want to look presentable because the way you look will determine the way you are dressed. No tattoo showing, like my sweetie. So just have to like dress like corporate, like let them see that okay, this is. Yeah. Then this is like okay, let's say Miss Harper. I'm working with Miss Harper now, and she's having a party, like she's having something, maybe a birthday, or she wants to surprise her husband or something, or there's you can dress this way. This is very funky. This is like more like me. I can do this because I'm a Muslim. This is funky. Okay. Yeah, because dressing this way is like, okay, wow, she's actually covering the body, but she's looking funky. This way too, this looks so stylish. I'm sure Miss Harper, this suits you. Yeah. Right?
Yes, that's me.
Yeah. So this is just a preview of how you can dress in a workplace. Depends on the environment, depends on where you work in. So, any question for me, please?
In the middle.
This one?
Yeah. What type of attire is that again?
This one is a professional business attire.
Okay, that's
Probably you're going for a conference meeting. You're going for maybe training,
right.
Something like more corporate. Yeah.
And also for interviewing.
Right.
Even anytime, yeah.
Interviewing.
Yeah.
Mm-hmm. And those 4 ladies at the bottom, those are appropriate for interviewing as well. The only thing is those skirts are a little bit
too
too
mini,
short.
Yeah.
So you want it
Knee
to the knee. Yeah. Yeah.
And it looked like more than like
Yeah. Yeah. So yeah, exactly.
Yeah.
That's
Any more
lovely.
questions for me?
I don't know what I'm gonna do with you. I don't know what I'm gonna do with you. Thank you so much,
Thank you.
Timmy. Thank you, thank you. Okay, so we're gonna bring this back up so we can lecture off the board. Oh yeah, and then can I keep
Put
it?
there, yeah.
Okay, so I'm gonna have all this posted on the wall when I get a chance to do that. I'm gonna have it all posted on the wall. You did a fantastic job, Timmy. Okay, so I look forward to seeing y'all do y'all presentation in between. I getting hair in my mouth. In between interviewing with Mr. Young and Mr. York. Okay, so as your turn comes, you know what's there. All right.
Wait a minute. So look, when it's time to do the interview with Mr. York, don't wear the perfume and stuff like that.
You can wear that, but what I'm saying is, when a job tells you, this is like even with Mr. Young, you can wear that. He doesn't mind that.
Okay.
But in other places, I wouldn't. You can wear it, just wear something light.
Okay.
Something light, nothing loud. Okay? Like rose petals and stuff like that, something real light.
Okay, so from August 15, I'm sorry. So from August 15 to to it's time for us to do the test. So what we're gonna be like, well, my group will be coming every time we come to class, come in almost like interview clothes.
Every day when you come?
Yes.
So say for example, kind of like business casual.
Okay.
Want you to come dressed up. We're gonna also work with Texas Workforce Commission to get y'all that referral to Dress for Success, so that y'all can get you some clothes with them as well. But at least we want you all dressed up, some slacks, a blouse, or maybe a skirt or a dress of some sort. Come to class in that, and then go to work.
Okay, and now would we be going straight to work after the 15th, or?
Just like I did with them, 2 weeks prior somewhere, you all will be starting your externship, your apprenticeship. I'm forgetting what school I'm at. Your apprenticeship. And then you have 2 weeks with them, but you still have to come to school with me. Because you'll be off on Friday, you'll be off on Monday, so you can work all day. You come to me from 8:30 till 11 o'clock, so you can say, Miss Harper, I've learned this, because I want to hear progress notes, how you doing at your job, and I want to help explain. Okay, this is what you're seeing, and da 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 da. You may want to ask them this, that. Do you understand what I'm saying? And then once you're doing that, you're going to be leaving at 11 o'clock, going to work. It's kind of like high school. Kind of like that.
I have a question. Once we finish the apprenticeship and we get our assignment, we get our job, say for like 6 months into the job, would there be like more training? Would there be like other seminars going on to above us with other networks or anything to that effect? Or
That's a very good question, and I have to ask Mr. York, because that's all his. Yeah, but that is a very good question, and remind me to ask him that. Please remind me to ask him. Yeah. Mm-hmm. Very good. Okay, so computers in the medical office. What we're going to do until we get the software uploaded, I want everyone to pick up this paper here. This is a CMS 1500 form. This is a CMS 1500 form. So I'm showing you right here on YouTube what this is. Okay. So when you get ready to do the medical billing software stuff, and when you print these out, when it's time for you to print them out, and you print these out for reasons of if you're trying to appeal for a claim, if you're trying to do secondary billing, tertiary billing. Secondary billing is after you send it to the insurance the first time. When it comes back with the EOB, if the person has a second insurance, then you're going to print up this, send a copy of the EOB from the first insurance, and resubmit the bill to the second insurance. That's called secondary billing. Okay. So I'm teaching y'all these different lingos and conversations of how to do that. Does everybody understand? Right. Okay. So it's important that you all understand how to fill out this CMS 1500 form. It's not going to look exactly like this on every software that you work on, no matter what doctor's office that you're working on. It's not going to look exactly like this on the software itself. But when you print it up, it will format on a hard copy like this. So you need to understand what goes where. Okay? What goes where. Okay, now let's turn chapter 1 in our computers in the medical office book. And I have, what edition is this? The 9th edition. If you have the 8th edition, that's fine. If you have the 7th edition, that's fine. Each edition is going to be a little bit different than the other, but you can still follow along. Okay. Part 1, Introduction, Life-Changing Healthcare. Okay, so life-changing healthcare has a lot to do with healthy lives, access to care. This is page 3. Healthcare quality, healthcare efficiency, healthcare equity. Okay, we've already talked about on page 4. We already talked about the health information technology, which is the electronic medical records. Okay, in the electronic medical records, you all should have learned about the social history, the family history. You all should have learned about the SOAP notes because we talked about it enough before we came to the EMR. You all should have understood about what objective is. You all should know by now whose conversation is going on subjectively, whose conversation is going on objectively, and assessment. Where do we live? Assessment. Why do we live in assessment? Why do we live inside of assessment of the SOAP notes? Because we're looking for 2 things. Procedure and diagnosis. You go, Miss Mitchell. You go. We're looking for those 2 things in the SOAP notes under assessment. Procedure code and diagnosis code. Now, sometimes words, you may have to translate them into numbers, which are codes. Okay? And that book is utilized by what? What book is that we use for procedure code? No, not that one.
Oh, no. Wait. Right here.
Nope. What book we use for procedure codes? Somewhat. Not CMS.
Not CMS.
The CPT book. CPT book. Current procedural terminology book. Okay, I'm just kind of jogging our memory here. Okay, now for the diagnosis code, what kind of book do we use for that? ICD-10. ICD-10. Very good. Very good. Do we use ICD-10 PCS in a doctor's office?
No.
No. Very good, Monica. We use that where? In a hospital, which is known as what? Acute what? Care. Acute care. Okay, very good. Very good. Y'all got this. Okay, so now moving right along, when you finish with the EMR is sent to, some of you guys may work in a doctor's office where you're going to do the coder and the builder's job. Some of y'all gonna do just the coder's job. It depends on how large the practice is. Does everybody understand that? Okay, so now, with that, you have to understand how to take information from the EMR. Remember, everything happens from front office to back office that affects you at the end. The biller is the tail end person of everything. They are the tail end person. They are the other side of the slice of bread in a sandwich. Everybody understand that? All right. So let's look at number 1 on your paper here, because you need to understand what you're looking at. Number 1. Number 1 says, what kind of insurance plans do you use? Okay. So I'm going to write down an example up here. And I'm going to say that the person has Cigna HMO, and their subscriber number. What's another name? Policy holder. Okay. Number. Very good. Maybe we'll say it's W00123456 Okay. And we're going to say their group number is 1100. Okay. All right. So looking at box 1 on your CMS 1500 form. Now we have some choices here that we're going to choose. Remember, on the software, it's not going to look like this on the software. It's going to look different. When you need to print it up is the only time it'll look like this. Does everybody understand that? All right. So now we have Medicare, we have Medicaid, we have TRICARE, we have CHAMP-VA. Those are what type of insurance plans? Remember, we said governmental and commercial. So what? Those are governmental. Very good. Okay. Now we have group health plan. Group health plan is known as commercial. Are we going to check off group health plan? Yes.
Wow.
Yes.
For Cigna. Yes. For Cigna.
Because Cigna is a commercial insurance.
Right.
So it is a group health plan. It is a group health plan that you acquired through employment. It is a group health plan that you acquired through, I want to say Obamacare, but healthcare reform. Marketplace. There you go. That's the proper name. Through Marketplace. It's a group health plan. Okay. Very good. So y'all mark that off. Okay.
Why would it be other?
Other is like, there are like cost shares insurance out there that you may pay like $200 a month, but it has to, everybody pitches in $200 a month. And then it divides up into who gets so much paid per claim.
Oh, so it's almost like a paid copay.
Kind of like that. It's kind of like prepaid insurance. Yeah, it has a deductible, but it's cost share. So it's a community of people that buys into this plan. It's a money pot. It's a community of people that buys into this plan, and if it's $200,000 in this money pot, then $200,000 is divided among folks that need their coverage covered, and it depends on what the coverage is about. Those are okay plans, to have. It's better than nothing, but my opinion, I'm grateful. Thank you, God, I'm blessed. I wouldn't want that because my stuff is very expensive. Yeah, I would eat that whole pot.
We do ever get an instance where someone, this might sound crazy, pay cash?
Yes, you will get an instance where someone pay cash, and so you don't use this. You don't use number 1 at all. And now, that's a very good question. I want you to come back to that, put a pin in it, because we're going to talk about patients that pay for their stuff up front, and you can fill out a claim form for them, and they can still get reimbursed back.
So and that wouldn't be used as other if they use the money. Cash.
I guess you can use other. That's fine. But I wouldn't personally, but you can if you want to. Just make sure that at the bottom here, when we get to the bottom, that we stated that they pay cash. Yeah, because a lot of times folks that pay for their own stuff up front, and it's very rare you have some folks that'll do that. They rather file it themselves to their pockets. Okay. You just have some meticulous folks that are like that. You know, and these are kind of like the wealthy people. They're kind of funny like that. Well, yeah, it's a good question. Yeah, so you could check off other if you like to, but I wouldn't, you know, because I wouldn't want to confuse anybody. But other is for those cost shares insurances. Yeah. Okay, 1A, insurer's ID number. Now, an insurance ID number has the same language of conversation as subscriber number or policy holder number. Does everybody understand that? If it says insurance ID number, you need to write down what that number is. What is that number?
4, 5, 6, 7.
There you go. And it's important to add that alphabet in front.
Right.
Does everybody understand that? Please add that alphabet in front. So go ahead and write that in.
This was right on question.
Yeah, you can write on the sheet. Yeah, that's why I want everybody to write on this. Whatever I write on the board and I'm lecturing, I want you to write it as I'm talking.
I was the insured ID number.
Yes.
Okay. 1A. Do you know? Wait. Do you know if she's pregnant?
Houston. And his zip code is 77036. Now y'all know automatically you put the state, right?
Yeah. Right.
Mm-hmm. Put the state. All right. So box 2, you're going to put the last name first. So the last name first is Smith. First name is okay. If he has a middle initial, use it. If he doesn't, it's okay.
I thought his last name.
Yeah, I know. So on this paper here, it wants you to put Smith and then Joe.
I was looking right at it too, and I feel pretty.
That's okay. All right. Okay. August 14, 1996. Okay, all right. Now, let me say this. Sometimes we're living in this society now when we're having transgender. Well, that's a nice suggestion, but according to government papers, you have to put what they are.
Government.
The government papers. And the government papers, they have to state, you know, on their insurance, they can change the names or whatever, but if they're working for an employer, that employer is going to go by their government name on their social security card, their government name on their driver's license, and what sex they are. Governmental.
Okay, so when you get the ID from that person, you don't have to,
Huh?
you don't have to ask that person, because how can, like, what if you can't tell?
They know. They know. When you have to ask for a copy of that driver's license, they can look however they want to look. That driver's license governmentally is going to speak to who they are.
Right.
Because if they want their W-2s, they got to follow the law of the land.
So this information that we put in is from their ID, right?
It's from their, well, some of it's from their insurance ID and some of it's from their Texas ID. We'll get to that in a minute. But I had to put a caveat there because if that person comes in, they say, no, I'm female. Okay, but your Texas ID says, or your driver's ID says, or your state ID says that you're male. We have to put that on there. We'll acknowledge you and call you Mrs. if that's what you prefer. We'll do that. We'll honor you with that. But the government says this. Why? Because your insurance is linked to your Social Security number. It's linked to your job. If you're going to get mad at your employer. You're going to get mad at the employer, get mad at the government. It's the law of the land. Okay, it's the same thing. If they come in and they say, no, I'm a mister. Okay, your government ID says this is who you are. Okay. Your job, yes, ma'am. Could you pass them out, please? And she didn't have to print them in color, bless her heart. Well, okay.
Is that for the
the third
so
one.
what I basically
Do
I
this,
just
repeat
do
the same
thing,
process.
make up another email
Mm-hmm.
and password, right?
Mm-hmm.
Cool.
Mm-hmm. Mm-hmm. So, what I'm teaching you, ladies, is to honor the person. Honor will win them over and keep the peace. It's important that we keep the peace. Does everybody understand that? Yeah, keep the peace. Now, but you have to explain to them, we have to go according to what your government document says. Does everybody understand that? Please explain that to them every time. Okay? All right. Number 4, insured's name. Okay, so the insured's name. So he is self-insured. This is about him. This is about self. And he is the employee. Okay, he is the employee.
Write down self.
Just write it down, right?
Okay, wait a minute. Let's look at the box. Let's go back to the box. Insured's name. Who's the insured? Joe Smith. So we're going to write his last name and his first name. Thank you.
And where do you say the middle name come in at?
So last name, first name, middle name. Mm-hmm. It could be Smith, Joe, M for Michael.
Right.
Mm-hmm.
Right?
Number 4, honey. Number 4. We're going one box at a time. One box at a time. Follow with me. Okay, look at box number 5. Box number 5. The address. The address. Does everybody understand that? Where does the address go? What is the address?
Yes.
Okay. You know, that used to be a soap opera.
Yeah. That's why I said. It was a daytime. It was a daytime.
It was a nighttime. Yeah, because we would watch
Dallas
and Blake. Blake Carrington. Dynasty. All right, sweetheart. You have a blessed one. Yeah, there you go. Yeah. That was my night to watch TV, girl. That was my night to watch TV. Mm-hmm. That was it. That was it, girl. That was it. Who shot JR? Who shot Chip to the patient? The relationship to the insured. I'm sorry. Self. Does everybody understand that? Insured's address. Now, for number 7, you can use same or you can rewrite it. Either one.
So we're just gonna put same.
Yeah, you can put same. You can put same. Okay. In box number 7.
Number 7.
Yeah, we're on number 7.
Address, and that's the insured address right there.
Yeah, you can rewrite it if you want to. That's fine.
Now, when you put same, do you have to put same as in the
City.
name, the city, state?
No, you don't have to. It's assumably to tell you, because once you go back over here to number 5 and complete all that for box number 5, when you put same on the box number 7, it assumes box number 5.
Oh, okay.
It assumes them to refer back to that. Mm-hmm. Okay, so we already know what city, what state he lives in box number 5. His telephone number. We don't have a telephone number for him. Let's make up a telephone number. Okay.
555.
Okay, so hold on. 555 666 77777. Okay, that sounds good to me. That'll work. I know, ain't it? I like how y'all think. That works for me. Works for me. Okay, now NUCC use. Okay. Thank you, ma'am. So we're gonna leave that blank. I don't know what that is, honestly, but we're gonna leave that blank. Does everybody understand that? Okay, very good. Now, number 9. Number 9 says name and other insurers policy number, group number. Okay, so he has no other insurance.
So number 9 would be NA.
Yes, you can put NA or you can put no other insurance. None applied. NA means none applied. None applied. Very good. Very good. Okay, now 9A, B, C, D. We're going to skip all of that. Let's go to box 10. Is the patient condition related to employment? No. Is the patient's condition related to an auto accident? No. Is the patient condition related to other accident? No. Other accident could be slip and fall at Walmart or
Fell off the ladder at work.
fell off the ladder at work. Yeah, it could be those kind of variations. Does everybody understand that? Huh? So we're gonna state that in a minute. We're gonna state that in a minute. Well, what I'm trying to do is go through this step by step, but keep it simple. And then I'm gonna escalate to difficult. So y'all have examples of simple to difficult, what to do with that. Okay, number 11, insurance policy group number or FECA number. FECA number is the governmental people. So that if he's a government employee and he has some sort of government insurance, then you'll use that. But we're gonna say that he's regular insurance, so he's got a regular group number. What's his group number? Okay, so please put that on there. Is that a 1 behind there?
No, 11 number.
You saying group numbers 11.
Okay, that's what I thought. Okay, I figured, did I put a 1 back there?
So that'll be for
The group number, that'll be for number 11. Okay, the group date of birth, the group sex, you can leave that blank. You don't have to put anything there. Other claim